Bula Vinaka, and welcome to Bula Wellness on FPC TV. I'm your host, Dr. Alisha Sahu Khan, the Head of Health Protection with the Ministry of Health and Medical Services. Today we're talking about rheumatic heart disease, a serious heart condition that affects almost one child in every classroom in Fiji. Rheumatic heart disease is caused by one or more episodes of rheumatic fever, an infectious disease that usually starts in children aged 5 to 15 as a sore throat or skin sores caused by bacteria called streptococcus. Rheumatic fever damages the heart valves or doors within your heart. This makes the valves leaky, and over time, the heart may be less able to pump blood around your body. With time, this could lead to heart failure and even death. To talk to us about rheumatic heart disease, we have Buli Waningolo in studio today. Buli has rheumatic heart disease, and she has used her experience as a person living with the disease to become an advocate for its prevention. In particular, she did this as a Miss Hibiscus contestant in 2017. And just last year, when she shared her story at the 71st World Health Assembly in Geneva. That a bit later in the show, but first, how much do you know about rheumatic heart disease?
What do you understand by rheumatic heart disease?
My understanding is it starts from inflammation. It can start and manifesting through symptoms of a sore throat and go all the way to inflammation of certain veins and certain ancillaries in the heart. At its core, that's my understanding. Obviously, there's probably much more behind it as well, which is probably in the professional nomenclature and literature, but I am aware about it, yeah.
What I understand by rheumatic heart diseases is mostly people who have weakness in hearts, and some people think it's heart attack. It's a common thought between people.
What age group do you think are the mostly affected ones?
I believe it's very susceptible for children to actually contract it. It can be also passed on. It starts with the throat and they're not that immune to it. However, with that said, the elderly, especially with people who have adopted a very carbohydrate-heavy diet and not looked after their diet, naturally your body doesn't produce that much antibodies. You need antibiotic treatment. So I think people who are affected the most are the higher age group, the older people, definitely. But with that said, I'm not excluding children, because they can also contract it quite quickly.
Usually I think it's always about 50 to 60. Now it's suddenly decreasing at a younger age, is about 40.
How do they contract this bacteria?
No, I'm not exactly aware of how it's contracted. I believe it's viral. It can be transmitted through contact with bacteria, or, like you said, playing in the soil. I believe through food contamination as well. It can lead to problems in the throat, which then manifests further down the line as rheumatic heart problems. Yeah.
As I said, it's up to their diet. If they don't eat healthy, it's too much cholesterol. It's just up to their diet and their lifestyle.
Do you think it's curable?
I think with the right treatment and adoption of the right nutrition program, you can deal with it. I believe there's antibiotics that can be administered to treat it initially. However, prevention is always better than cure, and adopting good diet, lifestyle is always important, hygiene especially as well.
It is preventable. It depends on your diet, on your exercise, but yeah, it's mostly up to you and how you decide to prevent it.
So many different opinions and thoughts from the public about rheumatic heart disease there. However, tonight let's welcome our guest, Miss Buli Waningolo. Buli.
Bula Vinaka, Dr. Alisha.
Thank you so much for coming on the show tonight.
Thank you for having me.
So we're going to talk a little bit about your journey with rheumatic heart disease. So can you tell us, how did you get diagnosed with this disease?
I had no idea. I did not know what rheumatic heart disease was. I was diagnosed in 2010 when I was 11 years old. I was in class 7. I was fortunate enough to have had been diagnosed by a school screening team that visited my school in Savu, and straight away I was diagnosed with rheumatic heart disease.
Did you have any sickness before this? Did you have any symptoms of the disease itself?
My mother and we had no idea of the symptoms, although I was presenting them. I had skin sores and at times sore throat that would present itself, but it would come and go, and joint pains as well. Yeah.
So we know that these sore throats that are caused by this bacteria, Streptococcus, and the skin sores as well, lead to the infection rheumatic fever, which attacks the heart. So if you keep having rheumatic fever, it keeps attacking the heart, and then you get rheumatic heart disease.
Yes.
So by the time you were diagnosed at age 11, you think you had a few episodes of this infectious disease, the sore throats and the skin sores. But did you have any heart symptoms that could have shown that, when you got the scan, that it answered some questions for you, or did you
Not
felt
at all.
completely fine?
Yeah, just taking part in sports in primary school. Yeah, no idea or no signs of a heart problem, just the symptoms of rheumatic fever. Yeah,
so you were a healthy 11-year-old child.
you could say that.
Yeah. So I think we all used to the school visits that happen in school when they come and do our checks. But this visit is a bit special. The screening that they do, could you describe it a bit?
We had to. It was a screening of the chest where they placed a gel on your chest and they moved this.
Like a probe, a scanning.
Yes, around your chest, and they would listen for a murmur. Yeah.
Okay. Oh, so they actually listened with a stethoscope first.
Yes.
Okay, and then after that, you would have gone for a scan to confirm that you actually have rheumatic heart disease.
It was being done at that.
Okay, so it was all in the one visit. It was a full screening. What do you remember how you felt when they told you? When they told your parents that you have rheumatic heart disease?
No, we were not told. I believe it was just to our parents when they were being called in. Yes. Although I still remember the pain from getting my first injection.
Okay.
Yes.
So this, of course, is the penicillin injection that people with rheumatic heart disease need to have every 3 weeks.
Yes, benzathine.
Benzathine, penicillin. So do you know, you of course would have been told why you needed to have that injection.
Yeah. Yes.
So to have that injection is to prevent further rheumatic fever and more damage to your heart
to the
valves.
heart valves, yes.
Okay. How did that make you feel, going for those injections every 3 weeks?
It's at first it was every 3 weeks. I usually went with my mother, and over time it became quite of a hassle. Yes, but I kept on taking my Benz.
I think we'll talk a bit more about that experience of getting those injections, those regular injections, after we come back from a short break. Welcome back to Bula Wellness on FBC TV. We are talking with Miss Buli Waningolo about rheumatic heart disease. Thank you again, Buli, for coming on the show today. Before we went for break, we talked a bit about how you prevent yourself from getting the complications of rheumatic heart disease, and this is through your regular penicillin injections. As we talked about before, as a young person, it must be not an easy thing to go in regularly for your injections. Could you tell me how having to do that, and also having the disease itself, how has that impacted your life?
After finding out that I live with rheumatic heart disease, it gave me, I believe it made me take ownership of my health. For example, making sure that I take my benzathine injection every 3 weeks, 4 weeks now, even if I feel well. And yes, it hasn't limited me from any activities. Although advocating for rheumatic heart disease has greatly boosted my confidence in public speaking.
So that's actually an advantage that you've gotten out of becoming an advocate
I believe
for
so.
the disease.
Yeah.
I'm very glad to hear that. And you haven't had any complications of the disease since you were diagnosed.
No.
Is that correct?
Yes.
Okay. Have you always gone in for your injections?
No. There was a time that I stopped taking my injections, but after getting a repeated series of rheumatic fever, joint pains, I had to go back.
Yes.
And this was in high school.
I'm very glad that you did. What would you say to someone who's been a young person who's recently been diagnosed with rheumatic heart disease and is having difficulty or finding it difficult to go in for the injections? What would you say to them right now?
To anyone who is finding difficulties in going in for your injection, do not be afraid to ask questions or to talk with the nurses at your health centers or the doctors even. They are always there to help. Yes, do keep on taking your benzathine injection even if you feel well. Yeah.
Thank you. I know you are someone who we see as a success story for rheumatic heart disease. You have kept up with your injections, you haven't had any complications of the disease, but that's not always the case.
Yes.
And could you tell me about some of the complications that you are hoping to prevent by going in for your injections? As someone with rheumatic heart disease, what do you know actually about the complications of the disease?
Rheumatic fever is the stage that we present symptoms of before getting rheumatic heart disease. Although once a person has rheumatic heart disease, they are still vulnerable to getting rheumatic fever, and this is the repeated joint pains. So adhering to the benzathine injections will actually prevent a repeated series of rheumatic fever. So it will also prevent further damaging of the heart valves. Yes.
So during the break you told me that you're on your 9th year of injections now.
Yes.
So coming up on 10 years, what happens after that?
I will have to go in for an echo with I think at the hospital.
So they'll rescan your heart.
Yes,
Yeah.
and they will assess whether I am to further, they will assess at which stage my heart condition is currently at, and yes, they will advise on whether to keep on taking treatment or, yes, where to go from there.
Great. So how did you become an advocate for this fight against the disease? You could have just stayed home and kept doing your, going through your normal life and adhering to your medications, your injections. What made you want to come out and talk about the disease?
It wasn't until my first support group, with a patient support group at Nashville Clinic, that I realized that I wasn't alone in this fight against rheumatic heart disease. I was fortunate to have been called by the team at the RHD program. They conduct support programs for patients, and that was how I met the team behind the RHD program. Yeah, and I guess I don't want others who are being newly diagnosed with rheumatic heart disease to feel alone. I felt alone. And to be that voice that calls out to them to adhere to their penicillin injections, that they are not alone. It's not the end of the world. They can achieve anything they want to be in life. And also to the parents, to be more supportive of their children and help them to take ownership of their lives.
Mm. Thank you, Buli. For anyone watching tonight, what advice would you have for them for preventing rheumatic heart disease?
To those living with rheumatic heart disease, it's not the end of the world. You can achieve anything you want to be in life. Keep taking your Benza even if you feel well. To parents and guardians, do look out for the symptoms of rheumatic fever and rheumatic heart disease. Take your child to your nearest health clinic if they're presenting symptoms of rheumatic fever, joint pains and sore throat, and get them checked by a doctor or nurse. And another note for those living with rheumatic heart disease, take your Benza even if you feel well.
Thank you, Mbuli. After the break, we follow the ministry's school health team as they conduct screening for rheumatic heart disease at a primary school in Suva. Don't go away.
Just the image of the valves, the heart, the valves inside the heart. That is the mitral valve, and that's the aortic valve, the one on top. So these two valves are mainly affected by the bacteria that causes RH, the rheumatic heart disease. There is no backflow plug there. Then moving on to the aortic valve. Scanning through the valve, aortic. Like you can see the colors and with smaller orange crystal. Just take off the color again and then do a study on him.
The Marita, the nurse, picks up any abnormalities. She detects any abnormalities in the valves and in the heart. She then makes a note. And then at the end of the school health team visit, on the last day of the school health team visit in a particular school, a sonographer comes from CWM.
I'm Merani Ngavindi, currently working for the school health team in subdivision. I'm a nurse practitioner, and we are doing a rheumatic heart disease screening team within schools within subdivision. The nurses initially do the screening, and the ones that they think meet the criteria, they come in and they are confirmed with the senior sonographers. On our last day, the senior sonographer comes with us, As you can see, she's sitting next to me, and she's doing her echo on one of the patients, on one of the students, sorry. On the very last day of which schools on schools that we go to, we have the sonographers with us, and they are the ones that confirm with us the students that we screen during our screening period in every schools that we go to. From here, that we go and sit with there's a certain day that we sit with the doctors or the consultants in children's outpatient, in children's ward, and they are the ones that will decide on the treatment on each and every students that we bring. Once the consultants see to the images, they decide on the treatment, and we normally contact the parents through their mobiles, and we tell them on which date we are bringing them for clinic. The students normally come with their parents during clinic, and that's when the doctors at outpatient discuss students of their conditions. The difficulties and the limitations we see in this thing is when we try to contact parents. Sometimes we've contacted the parents, and they are aware on which date they're supposed to bring their children, but sometimes the parents don't bring their students. So normally I call them again. I always call them again to tell them, we're setting you a new date, can you come back for clinic then? So it depends on the parents when can they bring their children. But that's one of the limitations or one of the difficulties we see. I'm finding with the children who are coming in for screening with rheumatic heart disease. Secondly, sometimes parents don't consent. It's either the parents are not aware of why are we doing screening, or the children are not explaining or not telling the parents properly why is it that we are screening all the classic students within subdivision. And sometimes the phone numbers or the phone contacts of the parents, either they've changed their mobiles or there's something wrong with the numbers that we sometimes cannot reach to the parents, and these students normally are left out, or they don't come in for clinic. We need the parent support in terms of children coming in for clinic.
Unfortunately, time has caught up with us again, and this brings us to the end of this episode of Bula Wellness. I hope you enjoyed the program and learned a few things about rheumatic heart disease. Important information that could save the life of someone that you love. If you have queries about the show or the topic today, like or contact us on Facebook, Bula Wellness FBC TV, or write to us at bulawellness@fbc.com.fj. Make sure to join us again the same time next week for our next episode of Bula Wellness. Until then, good night.